Redlining has a long, profound reach, and it continues to affect people of color in many aspects of their lives, especially their health, as you'll see in this video. After the Great Depression in the 1930s, President FDR wanted to bring economic relief to Americans. But let's preface this with the fact that it was the 1930s, so his concern was really for white Americans. The federal government started a series of programs called the New Deal. Besides increasing the housing stock, the New Deal purposefully segregated white Americans from black Americans, immigrants, and Latinos. The New Deal offered incentives for whites to move out of inner-city neighborhoods to the suburbs, a phenomenon known as white flight, by providing mortgage programs with targeted eligibility. The New Deal introduced legislation called the National Housing Act of 1934 to make housing and mortgages more accessible and affordable for white Americans. To further perpetuate segregation, the Homeowners Loan Corporation introduced a system of mapping of neighborhoods in cities across America called redlining. The HOLC graded and color-coded neighborhoods into 4 categories based on racial qualifications. Neighborhoods graded as A were best, B was still desirable, C was definitely declining, and D was hazardous. The government backed $120 billion in low-cost home loans between 1934 and 1962. More than 98% of the loans went to white home buyers. African American families were prohibited from buying homes in the suburbs and gained none of the equity appreciation that whites gained. While white neighborhoods flourished, low-income minority neighborhoods attracted factories with dangerous pollutants, resulting in numerous health concerns. By policy, black people were forced into neighborhoods that were underdeveloped. Also as a result of redlining, public and private investments were blocked in black neighborhoods. Property values decreased, city services were unreliable, crime increased, and a host of other inequities arose. This included disparities in health and education because local property taxes pay for our schools, hospitals, and other resources. Housing segregation was banned in 1968, but it didn't matter. The government had already been successful in creating the wealth gap between white and black home ownership. Today, for every $100 held by a white family, black families have $5.04. The effects of redlining still permeate our U.S. cities. Although it has evolved somewhat, it is still practiced in New Jersey, home of Robert Wood Johnson Barnabas Health. Banks no longer openly talk about explicitly denying black people loans. Instead, some banks have quietly institutionalized bias in their operations. As recent as 2018, Hudson City Savings Bank settled a housing discrimination lawsuit in Hudson County for about $33 million, the largest redlining settlement in U.S. history. Today, homes in black neighborhoods are valued at 25% lower than those in white neighborhoods. Many counties provide funding and resources to prevent chronic illnesses based on a 3-4-50 framework. There are 3 behaviors that affect 4 health conditions that contribute to 50% of all deaths. The 3 behaviors are physical inactivity, inadequate diets, and tobacco use. When there are few green spaces, trails, and fitness clubs in neighborhoods, then people don't get enough physical activity. When there are little to no grocery stores, people do not get adequate nutrition. And when the availability of tobacco and alcohol is higher in these neighborhoods, then that brings on additional health problems. Healthy living should be a right for everyone. However, one of the consequences of redlining is that many people live in food deserts. Food deserts are low-income communities where access to affordable, healthy food is limited or non-existent because grocery stores are too far away. The absence of affordable, healthy food, mostly in urban and rural communities, contributes to poor diet, obesity, and other diet-related illnesses. According to the United States Department of Agriculture, about 23.5 million people live in food deserts. This includes approximately 2.3 million people who live in low-income rural areas, do not have access to a vehicle, and are more than 10 miles from a supermarket. In New Jersey, the USDA has identified 134 food deserts, which affects approximately 340,000 residents. Additionally, the Reinvestment Fund, a nonprofit organization, has identified 10% of New Jersey's population, 924,000 residents, as food insecure, even if not in a federally recognized food desert. To be food secure means there is adequate food available and an individual has the ability to access it. In spite of the generational effects of racism and redlining, many healthcare organizations are going beyond the hospital to address food insecurity and health disparities in New Jersey. Robert Wood Johnson Barnabas Health has created a program called Health Beyond the Hospital to address not only food insecurity, but other social determinants such as housing, income, and education, all of which have significant effects on health outcomes. RWJBH is also committed to equity. Its initiative, Ending Racism Together, focuses on creating racial, ethnic, and cultural equity, prioritizing those communities that are most disenfranchised. For more information on these programs, or to learn more about these initiatives from Robert Wood Johnson Barnabas Health, visit our website at rwjbh.org.